My name is Matt Mayo, and I am the Assistant Executive Director and Healthcare Center Administrator at Masonic Village in Lancaster County. One consistent truth I've learned from my 25-plus years working in the senior living sector is that Medicaid does not pay the bills. Masonic Village at Elizabethtown has 453 licensed nursing home beds, and 65% of our resident demographic is on medical assistance. The state's low Medicaid reimbursement rate allows us to barely pay above a living wage for vital positions that make up our care teams, which makes recruiting and retaining qualified and dedicated staff extremely difficult. An appropriate increase in Medicaid funding would enable us to adequately compensate housekeepers, food service staff, nurse aides, and LPNs, who are the heartbeat of our organization. With increased funding, nursing homes could better compete with wages offered by hospitals and other industries. We could better align our salaries and benefits with what today's workers are looking for. Instead, too much of our time and resources are dedicated to piecing together costly, temporary agency staff arrangements, fighting to qualify for limited and administrative time-consuming incentive programs, and reevaluating the number of residents we are able to care for. Which is why, due to the lower than average state funding and staffing limitations, Masonic Village at Elizabethtown has had to decrease the number of available resident beds. While some were converted from semi-private to private rooms, the overall decrease represents about 100 fewer beds. That's 100 fewer residents receiving care. What's happening today is reminiscent of the early days of the pandemic. Due to staffing limitations, units were closed. The number of available beds decreased, and there was an overall loss of nursing homes statewide. Hospital systems had nowhere to discharge patients as nursing homes closed their doors. If the Medicaid rate of our most vulnerable does not start keeping pace with top quality care, health systems will see a repeat of the early pandemic times. We are calling on legislators now for their support. Tomorrow is too late.